We are back for another week of Excuse Me, Doctor. So, welcome, my Be Health Empowered family. My name is, of course, Dr. Melissa Clark. Love when you call me Dr. Mel. And we're doing what we do every week here on Excuse Me, Doctor. That is bringing you the information that you need, the fact based information that you need to make wise health decisions, not just for yourself, but for your family and for your community. So, thank you for tuning in on whatever platform you're checking us out on. If it happens to be Facebook, please go ahead and hit that like button for me. And if you're on YouTube, please hit that subscribe button. We greatly appreciate you for it. And for my newbies, welcome, of course. We are here to answer your questions and hear from you. So please don't hesitate to go ahead and comment in the chat. But most importantly, put your questions in there because we're going to get to them as the show goes on. So thanks for joining. And for those of you all who are longtime listeners, you know who is waiting in the wings to be brought in. And those are my co-hosts, my fantastic, wonderful co-hosts, Mr. Wayne Bruce and Miss Lila Mays. How y'all doing?
Hey, happy Monday.
Happy Monday. Wayne Bruce, are you with us?
Brother producer.
Oh, okay. He's wearing his technical hat right now, getting it together. But
I ain't wearing
as
no technical
always,
hats. I'm just
what
Monday.
are you doing?
It's just Monday.
It's just Manic Monday.
Monday is Monday.
It's just another Manic Monday.
Just another Manic Monday. I will be pulled off air for that. Anyway,
okay,
hey,
fine.
Dr. Mel, how you doing? How you doing, live?
I am fantastic. I am excited to start this amazing week.
I'm excited.
Happy to be back with my Be Health Empowered family.
Be back.
Me too.
Be Health Empowered.
Yeah.
Right on.
Right on. So what's going on the show today, y'all?
So look, today we are shining a spotlight on a critical yet often overlooked topic. How some Black children's speak is being used to misdiagnose them with learning or speech disorders.
Wow. And as it turns out, that has a bunch of effects, not just in their learning in school, but future health and development,
Sure.
And to help us understand this complex issue, right? We have a cutting edge researcher and a speech language professional who has extensive experience in this, and she is going to walk us through how to address it and prevent it from happening.
Right. I mean, I think this is a great example of how health is impacted by everything, right?
Mm-hmm.
Everything.
Our education, our neighborhood, where we live is called social drivers of health. But this one in particular affects the baby. So I was really, when I saw this, I was like, we have to have this guest on because she's going to break it down. So everybody, please tune in, share it with anybody you know who has.
Pass it along.
Yeah. Pass it along. Anybody you know has kids in school because it's going to be critical. So share.
Yeah, pass it. From the left side, like the Dutchie. Anyway,
Right.
Let's get into the week that was.
Yes, please, let's do that before
health and wellness
promoting recreational substances.
Here we go. The week that was.
The week
recap.
that was.
Mm-hmm.
Yeah, so it's summertime, and with these hot temperatures come the summer surge. It's back. The COVID summer surge, that is.
The COVID.
That's right.
All caps.
And even though this is our fourth year going into it, a lot of people still don't realize it happens every summer and every winter. It's just at what date during the summer does it happen? And, for me, this is the first, this time last year was the first time I had COVID. I got caught up in that summer surge.
Yeah.
So what we're seeing right now is that emergency department visits are up in at least 39 states across the Midwest, the Northeast, and the South. I'm pretty sure it's going to get out west pretty soon. And it's all the new variants. We're actually up to, remember when we were in the A's and the B's, the alphas, the betas? So we're in the K's and the L's now, right? That's how
Wow.
many variants have been stacking up.
Variants
That is,
stacking like cards.
Like dominoes, exactly.
wow. I mean, it makes sense though, because people are traveling, they're inside, beating the heat, they're gathering. Should we be concerned about COVID still, Dr. Mill? I mean, I think we know the answer,
Well,
but
yeah, we know the answer.
how
Well,
much
the
should we
fact of
be
the matter
concerned?
is, because infections have been getting milder for the majority of the population because people have been exposed and they've been vaccinated, meaning they've had infections before and they've been
Mhm.
vaccinated, we're seeing milder infections. However, again, for the medically vulnerable, people who have chronic illnesses, or those who are around them, you have to remain vigilant, mask up when you're indoors, wash your hands, and increase the ventilation and the air quality indoors whenever possible.
Okay.
But this is true for everybody, no matter if you're vaccinated, if you have had COVID before. The more times you get COVID, no matter how healthy you are, your risk for long COVID goes up. Vaccination does decrease that risk, though. So that is one of the reasons to get vaccinated.
Okay, so if you haven't gotten vaccinated yet, should you?
Yes, most definitely.
Okay.
The CDC just updated the vaccine recommendations for this fall for everybody 6 months and older. But in the meantime, the new batch of vaccines with this current variant is coming out in the fall. So the question is, if you haven't gotten vaccinated since last fall, should you do it now? Right?
Mhm. Mhm.
Um, well, realize that it's not going to provide complete protection, but it'll provide more protection than if you don't get it. If you're 65 and older and you have not been vaccinated since last fall, you probably should get it. If you're pretty healthy, younger than 65, I would talk it over with your doctor to decide, should you get it now or just keep super safe until the vaccines come out in the fall.
Well,
But
a
if you
lot of us.
don't, there's a pretty good chance you're going to get infected
Okay, I was
this
gonna
summer.
say a lot of us are gathering down in New Orleans in a few days.
Right.
Mhm.
They
I
call
think
it
some of you,
they call it the annual trek to Essence.
yes.
It's this
Right. Oh,
I'm
I didn't know.
thinking
Check
that
you out. Going to the Essence Fest. Okay.
well, I mean,
I
I'm
see you.
working, but I think some of us should explore some vaccinations before we get down there, good people.
Yeah,
Sounds a
takes
good
I,
three
I'm no
weeks.
psychic. I am no psychic or anything, but I foresee a super spreader event.
Oh wow, yeah. I mean, it's not funny, but yeah,
Yeah.
I'm with
I it reminds me of the old Johnny Carson thing where he put the envelope to his head.
Right. What
you.
was his
Right.
name?
What
Right,
the great
right.
Karnak.
Karnak.
The
The
great
great
Karnak.
Karnak. Yeah. I'm no great Karnak.
What is a super spreader event?
Yeah,
Yeah,
exactly. So
yeah,
mask up when you're inside,
for sure,
for
for
sure.
sure.
Mhm.
Yeah.
On the plane
All
too,
right.
right? Mm.
Yep. Oh, absolutely. And in the airport. Yep.
Mhm.
Yeah. So look, big prep news in the world of HIV, and for all our family out there, all our Be Healthy Power family who know someone with HIV or who have HIV, this is big news. So, is there a
Yeah.
new way to prevent HIV, Dr. Mel?
Yeah, this is about HIV prevention. So
Mhm.
if you've heard of PrEP, you've seen the Truvada, Descovy, those are the pills that you take daily to prevent HIV if you're sexually active and in a high risk community,
Yep, you
right?
see those commercials where everybody is living their best life, having everybody happy. You know, we actually had a show about PrEP and HIV a
Mhm.
few weeks ago. Check
Yes,
that
Yep,
out with Sarah
exactly.
Prince. She was
Yes,
incredible.
she was.
absolutely.
Check
So
it
it
out.
turns out, though, there's now a way to get an injection twice a year that is 100% effective in preventing HIV. I
Wow.
said 100% effective in producing in preventing HIV. And this is data that was done in a trial among Ugandan women and South African women. They got this every 6 months injection of a drug called um, lenacapavir, and it showed that none of the over 2,000 women in the arm of the trial who received the medication, none of them contracted HIV, whereas there was about a 1.5% risk of contracting it if you were taking pills, right?
Mm.
And it's probably, as you can
It's
imagine.
yeah, it's probably easier to get an injection twice a year than take a pill, having to take a pill every day, especially if you're not sick.
Yeah.
Right.
Right.
Exactly. Yeah. Who's going to remember to take a pill, right? So now, really, cost is the major hurdle. The cost of the drug is like $42,000 a year.
Oh wow.
For
So
2 shots.
that's going to be, yeah, for the 2 shot thing, right? So they're gonna have to figure out how to bring that cost down, especially in areas of the world like Uganda and South Africa, where HIV is more prevalent, right?
Mhm.
So
Mhm.
we'll watch this space, but I think that's really important news for everybody.
I
Yeah,
think
that's
that's
big news.
incredible.
That's huge.
Yeah.
All right. Coming on down to number 3. Heat wave and your meds.
hmm So it's global warming. Global warming is happening, and everywhere seems like at some point has gone through a heat wave already this summer.
Yeah.
Exactly. Just a couple of weeks ago, did you all see that like I know the number got up to 1,300 people died at the annual Hajj Mecca due to heat and
Yeah.
heat related issues.
Yep.
Wow.
And it was
It's
tragic.
terrible.
And
Terrible.
you
Terrible.
know, no doubt that some of those people were more susceptible because of the medications they were on. And
Yeah.
people don't
Mhm.
realize how some medications you're on can interact to make you more vulnerable to the heat,
Mhm.
because it makes
Mhm.
it harder for your body to adjust
Mhm.
to extreme heat.
Wow.
Okay, so what are those kinds of meds, Dr. Mel?
So they're kind of in three categories. One are diuretics like hydrochlorothiazide. They
Mhm.
decrease salt and water in your body, so it makes you become dehydrated more easily, and so you're more susceptible to heat stroke.
Yeah,
Okay.
the old people used to call those. "Okay, I need to take my water pill because
There
because
you
they
go.
make you weak."
Oh,
Exactly.
oh,
Right.
old people don't just say that.
I know. I said that because my grandmother used to say, "I'll take my
Oh,
water
right,
pill."
Right.
right, right, right. My
Nope.
grandmother used to say, I gotta take my water
My
Yeah.
water
pill.
pill. So the second category is amphetamines, and you might,
Mhm.
who takes amphetamines? Well, that's Adderall, Ritalin, Vyvanase, which are commonly used to treat ADHD, and they can cause your body temperature to run higher. So therefore,
Mhm.
again, more susceptible to heat stroke. And then the third category are those medicines that work on the nervous system, like that are used to treat depression, schizophrenia, and Parkinson's disease.
Mhm.
They include antihistamines, like beta blocker. Oh, like Benadryl. They also include beta blockers, which are a type of heart medicine.
Mhm.
They tend to end in the in OL, like labetalol is an
Okay.
example,
Okay.
and those affect your body's ability to sweat,
Mm.
and therefore to cool down. So again, all these things can make you more susceptible to the heat.
So should people stop taking their medication when it's high heat?
No, definitely not. It's never a good idea to just stop taking your medicine without the guidance of a doctor, but it is
Mhm.
important to take precautions. So you want to limit the time you're outside. If you're on these medicines, dress in breathable, lightweight clothing, and definitely hydrate, hydrate, hydrate.
So, Dr. Mel, what are the signs of heat stroke um, that we should know about, and what do we do if we get them?
Sure.
If we're
So heat stroke
experiencing those?
is the first stage of heat illness, and it's characterized by sweating, sudden fatigue, nausea, or dizziness. And then if you stop sweating, that means you've gone on to the second stage of heat
Oh
stroke,
wow.
and that's definitely a terrible sign. So immediately as you start to get these first signs, get out of the heat immediately, stop activity, drink water, lay down to help the blood flow get back to your heart and your brain. Put a cool, damp cloth on your face and your extremities, and
Mhm.
then call 911.
Yeah.
Or have somebody call 911, go to the nearest emergency department so you can get rehydrated and prevent the symptoms from worsening.
Mhm.
Okay.
Yep.
Wow.
Cool.
All right. So that's the recap, y'all.
Yeah.
Where we going? What's next? What's next up on the docket? What y'all think?
That tickles me every single time. I
Every
love it. So
time.
listen, every time. So this week we asked the people, uh-oh, my camera is being a little weird. We asked the people what they do to move their bodies. Dr. Mel, we had talked about you, we've mentioned it a few times. Sitting for long periods of time, sitting is the new smoking. So
Yes,
we
it
asked the
is.
people what they do to move their body during the day. And so
Great
Jasmine over
question.
at CVS said she walks and walks on her break. She walks around the building. And then on the weekends when she isn't working, because she doesn't have a job that has her sedentary, she actually walks during her workday. But
Mhm.
on the weekends, she has young children. And so she says she's always running around moving the body in the park and around the house. We asked Brother Leroy over
Leroy.
in Lamert Park. Listen, he's
Lemur
a
Park.
drummer.
Come on,
One
Leroy
of
the
the
drummer.
drum circle people. We asked Brother Leroy, and Brother Leroy said he sits a lot. He said he hadn't heard that sitting was the new smoking, and so
Well,
he was
you out
glad
there
that I asked him the
educating.
question so he can get up off of that seat and walk a little bit more around the
All
village.
right. All
So
right,
we
Leroy.
people drop in the chat what you do to move your body.
What do you do to move your body? Drop it in the chat. We're gonna come back to we're gonna come back to this because
All
people
right.
got something to
People
say
have
all
all
the
kinds of
time.
ways. I know I took a long walk before the show started. I walked about 3 miles. So yeah, I was getting it in. But thank you all. We're going to see you back in a little bit. Exactly. We're going to see what people put in the chat. And in the meantime, we're going to move into what we're talking about tonight, our main topic, the way we speak. It's unique. It comes from a mixture of culture, geography, community, family. But it turns out that instead of embracing differences, our health and our educational system can oftentimes mislabel, especially Black children, based upon speech patterns. So, we're going to explore how this is happening, what's going on, its consequences. We have a really enlightening conversation coming up with our special guest, Dr. Yolanda Holt. She is on the faculty at Eastern Carolina University and is a practicing speech language pathologist, serving both children and adults at home, school, and in hospital settings. Her research interests focus on the dialect variation in African American English and Southern American English. Thank you so much for joining us, Dr. Holt.
Thanks for having me. Glad to be here.
All right. So let's get started. Can you, first of all, help us know what does a speech language pathologist do and what role do you play in children's education? Okay.
We'll be right back.
we started
We'll be
without
right
Dr. Mel.
back.
We got to bring Dr. Mel
We'll
back.
be
Back.
right
We'll
back.
be right
That
back,
certainly was
Dr.
not
Mel.
supposed to happen.
That certainly was not supposed to happen.
So was Dr. Holt the one that went out or I
I
was?
think Dr. Holt is out. Dr. Holt,
All
you out?
right.
Yeah, Dr. Holt is out.
All right. Well, we'll just have to wait till she comes back. Well, in the meantime, what do y'all do to move? And what
Well,
do we do? Anybody put anything in the
let's
chat?
let's go to Christopher Holt. Christopher Holt says he walks his dog and they go for a walk in the middle of the day. They go for a walk in the middle of the day. Christopher Holt says that. But I think we have Dr. Holt back. Let's try to get her in. And
right.
I'm going to get you and Dr. Holt in two shot. And here.
All
So,
right,
am I
Dr.
back?
Holt. We are back and we are excited to have you. I think I already introduced what we're talking about. So I think we can move on to your sharing with us what does a speech language pathologist do and what role do you play in children's education?
All right. So, a speech language pathologist is a professional who's been trained to identify speech, language, or swallowing disorders in children and adults. That person holds at least a master's degree in speech and hearing science or speech pathology or communication sciences and disorders, depending on the program that they graduated from. That person is going to have a state license, and they should also have a certificate of clinical competence from our national organization, the American Speech Language Hearing Association, or you'll hear it called ASHA. Parents and caregivers can check for those credentials through the state and national websites or on the ASHA website. So the speech language pathologist is part of the medical, preschool, and educational community. They're going to interact with children and their adult caregivers and give information and provide therapy for speech, language, or swallowing disorders. And those things must have a negative impact on the child's ability to participate in their home or school environment. So sometimes parents will say, my child is a little different, or I'm not sure, especially if it's their first child, and they'll want to get the child evaluated. That's fine. But what we're really looking for is a negative impact on the child's ability to function in the community. And the way the diagnosis is made is by comparing what the child does when we see them with what other children their age and typically their sex or gender in the community do.
Well, hold on. When you say the way the diagnosis is made, what diagnosis are you talking about?
So when a child has a speech sound disorder, that means that they are not producing the sounds that they should have acquired by a particular age. So by the age of 2, we should be able to understand about 50% of what a child says, and that goes up 25% per year. So 3, 75, by 4, it should be about 100% that you understand what they're saying. When you can understand what they're saying, if their sentences don't make sense or you're like, that's when you want to reach out for some professional help.
Great. I'm glad we set the table like that because, this show is all about navigating the health system and it's based on, excuse me, doctor, I've got what? The book. And one of the chapters in there talks about all the different people you encounter in healthcare, one of whom is speech language pathologists. And so I think it's really important that people understand not only what you do, but how to check if that person has the right credentials. So glad that you went over that. And also you just schooled me on, what are the milestones for language development, right? And how do children acquire language skills to begin with?
So that's a really good question. And if we think about it, most of us don't recall learning how to talk or listen or tell or follow directions. And that's because in the typical development, we acquire the language of our community. And whatever language is spoken in your community, that's going to be the language that you learn. Sometimes it's the first language and you may learn other ones, but the one that is spoken in your community, that's the language that you're going to bring with you to school. So typically developing children learn to identify the important parts of words in their language. So the sounds that help us distinguish words, for example, p, b, like P and B, t, d, like T and D, and k, g, like K and G. Those help us tell the difference between words like pat and bat, tab and dab, or curl and girl. And so just going through everyday life, having conversations, children acquire language that way. But there's a little bit more. In English, we can have changes in the ending sounds that change a word's meaning. So, for
Mhm.
example, jump, jumps, and jumping, or pass, passed,
Right.
and passing. Those tell us when something happened. And
Right. So it tells you, based upon the ending of the word, what you're actually, the verb, subject, language, concordance, and kind of helps you distinguish the word, correct? I think we're having some technical difficulties with Dr. Holt, but yeah, just to sort of pick up on one of the points I was talking about before until she gets back, how important it is to be able to understand all the members of the healthcare team, including the speech language pathologist. And I think she talked about the Association of Speech Language Pathologists, to be able to understand, to understand, is this person actually credentialed? They should have a health credential to go along with it. Um, and just really important to know how to make sure the person you're dealing with is legit. So, we left off around, thank you, I'm glad you're back. Um, what are some common speech and language disorders that you diagnose and treat in children?
so, the way that we think about speech and language disorders, there are 5 domains of language. That's going to be phonology, the sound system, morphology, the rules for changing word meaning. That's what we were talking about before, those ending sounds. We can have
Mhm,
syntax, which is where word order changes the meaning, semantics, which is how the word is used has meaning, and then pragmatics, which are those nonverbal communication or communication beyond the words. So if a
mm,
child has a deficit, which means they're not producing those things in the way that they should for their age, that's one of the ways that we diagnose a disorder. But
mhm.
Black children and people that use African American language already do some things differently. And I can give you a couple of examples if you're interested.
Yeah, please do. I mean, I
Okay,
think some of the people in the audience may already know, but I would love to hear how it figures into recognition of speech disorders.
great. So a child who uses African American language might say these, them, and those as dees, dem, and does. So they use
Mhm,
the D sound instead of the TH sound. Or they might say the plural as them two dog, or the possessive as that Shirley coat. So they modify the use of that final ending to identify plural or possessive. The child might change the word order. So they might say what time it is or whose shoes that is,
mhm,
instead of
mhm,
what time is it or whose shoes are those. Or
mhm,
some of our more flavorful ways of speaking, frontin', slamming, and grub, for being
mhm.
dishonest, exceptionally good, or for food. So those are things that are typically expected for African American language, and some Black kids may use that. What we're looking for disorder is not that children are doing things consistent with what's in their community, but what they're doing is out of step, both with what's happening in their community and what we expect universally for all children.
Got it. No, that's a really important distinction. And before we sort of get into what goes wrong in the diagnosis, maybe can you give us just a little bit of history about that speech pattern that you discussed? Where does it come from, and why is it important to be able to recognize it?
Sure. So African American language is a language form that has existed or became something that we have here in the United States, and it's across the English speaking North America. So that includes Canada. We're specifically talking about the United States here, due specifically to the African American people being enslaved. So during that time period, those people came to the United States. They did not speak English. They spoke the languages that they had with them when they were brought here. And over the several hundred years or so, the language that they acquired, so they acquired English here from the people around them, but they modified that language and it's consistent. So African American English that's spoken in Louisiana, in North Carolina, in California, has some very basic consistencies. And people might say, well, that can't be true. Well, really? Is the English in Australia, in Canada, and England, is that mutually intelligible? Are there multiple parts of it that are similar? And we would say yes. So that's what we're talking about. There's a common background for people who are descendants of African slaves that make up African American language. And we've changed that over time to what we use today. One of the things I want to make sure that we kind of touch on is the pragmatic aspects of African American language. And those are the things that we do that are part of our culture that are not necessarily the words. It's the meaning beyond the words. It's the way that we communicate ideas. We talk with our eyes and our bodies. And girl, we can be having a whole conversation about something they don't even know what we're talking about, because we're using the same words, talking about the same thing, but we're on 2 or 3 different levels, right?
Girl.
Right? And
Yep.
so when we talk about African American language, we want to think about it in those positive terms of what it brings to the community and it brings to the people that use the language, and not accept what's been placed upon us with the idea of it being less than or lower than, because if it wasn't serving us, we wouldn't use it.
And I also think too that it there must have been a protective factor to it in the evolution of a language pattern that would be mainly understood by us for purposes of communication, for things that we did not want the majority white culture to know, just for our own protection, right? So yeah, so it has pragmatic and utilitarian value as well in some instances, at least historically. Um, so what's happening now with some speech language pathologists potentially misdiagnosing African American children who have these speech patterns?
So that's a complicated question. There are 2 levels to it, and I want to simplify it for our audience. So any child who comes to school with English as their first language should be making progress in a very similar way. So some of the examples that we gave for those sound changes, developmentally, by the time a child is 4, they're 100% intelligible. But children up to the age of 6, 7, sometimes even 8 will do things like say, the bird flew out the window, or they stopped at it. So those are things that are part of the developmental process. Some of those developmental things still occur in what we would consider the adult version of African American English, because that's the language that we speak. That's the way that it's structured. When the speech pathologist knows just the developmental information and doesn't have information about cultural variation, and we're specifically talking about African American languages, but it could be any culture. They're just using a standardized assessment, and they're not doing 2 things. One is to look to see if this child that I'm seeing is consistent with the other children in their classroom who are the same age, same gender, sex, and come from the same cultural background. The second thing is to actually talk to the families, because all Black families do not use African American language. There are many Black families who use standardized English. That's the way that they communicate, and it's been like that for several generations. And so those 2 things go together, which requires the speech pathologist to have a level of cultural humility. All the education that you have doesn't prepare you for all of the people that you're going to deal with. And that's where we start to have this issue of misdiagnosis. And that comes in 2 forms. Every Black child speaks African American language, so all these errors are related to their dialect. So you underdiagnose children. I don't know. I think they're fine. No, they're not fine. They use African American language. That's wrong. It's broken. They need standardized American English, or they can't learn to read, and that's overdiagnosis. And both of those are problematic for the child and for the school system.
So what are sort of looking forward into that child's development? Let's say they get overdiagnosed or misdiagnosed as having a speech disorder because of the way they speak. What are the potential consequences as they go through the educational system?
So if they're diagnosed with a disorder that doesn't exist, the child is being told by the school system that there's something wrong with the way that you're using language. And you're a child and you're like, okay, well, let me fix it. You go to the therapy sessions, you're spending that time, but there's actually nothing wrong. You're not learning something new. You're learning standardized American English.
Mhm.
So that's something that's taught in the regular ed classroom. And if you're typically developing with a little bit of practice, you can acquire that. What you're not
Mhm.
learning in the speech therapy room is math and science and music and art. And so this
Mhm.
child who should be progressing along with their peers because they're typically developing is being prevented from access to the standard curriculum because we're spending that time. And I want to take just a minute. If you see a kid twice a week for 30 minutes, that's 1 hour a week.
Mhm.
Children only go to school for 5 hours a day. So you're taking
Right.
20%
From
of that child. Right. That's a huge chunk. And when you multiply that over time, you can take away weeks of that child's education for something that they don't need therapy for.
Mhm.
And that's
Right.
very problematic.
And also too, you're using the resource of the speech professional's time where they could really be making a difference with another student, right? So you're misusing resources. And then what does that potentially also do to that child's confidence too? I mean, if they're being told something is wrong with them when it actually isn't. And
That's
what
the
effect?
biggest issue.
Yeah.
I'm sorry, go ahead.
No, no, no. Go ahead.
That's one of the bigger issues for the overdiagnosis is when you have a number of children who are being diagnosed as having disorder when they're not. You're also doing something in that environment. You're telling the classroom teacher that there's something wrong. You're telling the local education agency that there's something wrong with these children because the speech language pathologist actually has a lot of power in that situation to identify disorder, and you're communicating that across the school building and sometimes across the school district. And so those resources are misdirected. And those resources may not even need to be in your school. Maybe they need to be in another school where there's actually a need for that. Grossly speaking, there are only about 7% of children in a school that are going to have a speech and language disorder. And so if you have
Mhm.
more than 7%, somebody needs to be looking at why that is. Now, it is possible, just
Sure.
statistically possible that could happen, but not in every school.
Right. No, well, that makes perfect sense. So, what effect are there examples that you could think of that where you have seen sort of misdiagnosis affect the educational trajectory of Black children or just children in general who might get misdiagnosed for related reasons?
So the information that I kind of spoke with before, that time taken away from the regular ed classroom, that's going to have a negative impact on that individual child. But we want to kind of think more broadly that the therapist who is better trained and who's
Mhm.
culturally competent, who's looking at the standardized assessment, who's looking at the individual child's performance on a task, who's working to identify children, regardless of their cultural background, with their ability to acquire skills. Those types of interactions are going to have a greater positive effect on all of the
Mhm.
children that that therapist interacts with, as opposed to, you know, the idea that there's, a single case, because that's actually what we don't want. We don't want single cases of children who are misidentified and then they overcome that. We don't want this one great speech therapist who went in and saw all these great things happening. We want the profession of speech pathology and the public to recognize where these mismatches are occurring and how to address them, because the greatest thing that we could see, from this conversation and from empowering everyone who's tuned in to Excuse Me Doctor and works with Dr. Mel, is to recognize the power of the family and the power of the community to
Mhm.
push or culturally competent clinicians in your community. So we don't have these issues of this one child that was misdiagnosed and overcame that. But we have a community that's moving all of our children forward because we're recognizing the value that they bring into that classroom setting. So I hope that answers your question.
It does. It does. And then, we also talked about when you and I talked earlier, where are other areas in life where you might see um, uh, this affecting health status, for example, or economic success later in life for people or individuals who might get misdiagnosed?
So there's a couple of things that we know about the misdiagnosis, and that is that we don't have a predictive model, right? So we can't know statistically what would happen, but we do know statistically that by the third grade, children who acquire literacy by third grade do better than children who don't. And so the
Mhm.
science of reading is that big conversation we're having right now. And it's about phonological and phonemic awareness. That's the ability of
What does that
a
mean?
person to hear sounds and know how the sound changes words, the examples we gave before. And then the
Mhm.
listening and telling skills. So those are the foundational components for learning to read. So if your kiddo is able to do those things, regardless if they use African American language or not, they probably need to be in the regular ed setting. That means that they're going to acquire literacy and they're going to be able to continue on that trajectory and be successful. The flip
Mhm.
side is if your child needs intervention, they're going to get an enhanced and reinforced attention to those skills so that they can become a proficient reader. They can develop
Okay.
the vocabulary skills and the literacy skills to be successful outside of that speech therapy room. So the speech therapist's job is to support the literacy development, the language development, even things as simple as spelling and the sound changes to make word meaning changes, even stress, record versus record, those types of
Mhm.
things. And so those skills that are developed in the early elementary years are going to carry that student very, very far. And that's what we want. We want the children to get that level and type of education so that when they leave that therapy room and they leave the elementary school setting, they're successful in middle school, high school, and as far as they want to go.
Wonderful. Well, I think it is actually time to bring Lila and Wayne back, see if there are questions that are in the chat that people have for Dr. Holt. So, what are y'all seeing?
Lila?
Um, Dr. Holt, can you run that example back there at the top of when you were talking? You gave the example of the consonants and sounds that
The
make
V's.
sense
Yeah.
versus yeah, when children have a disorder. Can you run that back for us? I
So
think it was yeah.
For African American language, you mean the puba to the kuga?
Yes, that
All
exactly.
right. So the expectation for children by the age of about 4
4.
Mhm.
Okay.
is that they're 100% understandable to strangers.
Mm.
And that means that they are able to know the difference in sounds that change word meaning. So
Okay.
puh and buh, like pat and bat, tuh and duh, like tog and dog, and kuh and guh, like curl and girl. And by
Okay.
listening and being able to manipulate those sounds, we know, hey, they're learning language the way they're supposed to.
Okay.
So
Another
for
question.
somebody
Oh,
just to be clear, so somebody who speaks African American English is able to do those things. It's just
Mhm.
the other examples that you gave, for example, dropping the S on a word,
Mhm.
mm,
that is characteristic of African American English, but they have the basics down. Those other ka, ga, ta, da examples down.
Right.
Okay.
So let me make it even more simple. If in
okay.
your house
Mhm.
you would say whose shoe that is, That's something that you would expect your child to say.
Right.
In your house, if you say, it's two dog over there, or your cousin, or everybody around you except you, right? You speak proper, everybody else say, it's two dog over there. That's what you're going to have an expectation for the children. The children speak the way the people in their community speak.
Okay.
Right. Okay.
So we hear "cuh" in LA a lot. What's happening, "cuh"? I mean, no, that's
Right.
that's
No,
the
that's
No,
thing.
that's
true.
real.
Yeah.
That's
Yeah.
in the music and entertainment
Definitely
industry.
regional.
Yeah. Hey, "cuh." Hey, and it was difficult for me to even comprehend it, even being in entertainment most of my life. When I heard that, it kind of throws you. Hey, "cuh," and then everybody knew what they were talking about. Hey, "cuz." It was like, okay.
Right.
So,
But I think the point is the point is that
mhm,
because it's normal for a community that a child grows
Right.
up in, that's what
mhm. Right,
that's how they speak. They should not be misdiagnosed as having a
Right.
disorder,
right.
That
essentially.
that's
Exactly.
the huge piece. Oh, we lost her.
Oh, we lost her.
Yeah. Right.
Okay.
But I
Well,
think that's such a great distinction because we model what we're seeing in our homes. We're modeling,
Mhm.
right? We're parroting
Exactly.
what we're hearing in our community and what we hear in
mhm,
our home.
Mhm. It's just
exactly.
like a
Yeah.
child who grows up in a Spanish speaking house or a French
Exactly.
Mhm.
speaking house. Right.
Right. Yeah, we model just what we hear and see, you know,
Mhm.
and everything. So we do have a couple questions.
Cut out again.
We cut out again? Yeah.
Uh-oh. No, I think she's
Oh,
just frozen.
No, she's frozen.
Yeah.
This
So
happens.
what's the next question? We can tee it up for when she comes
We're gonna
back.
tee it up. We're gonna tee it up. We're gonna tee it up. Uh and it comes from Christopher Holt. Could be relations. How does Let's see if we can get Dr. Holt back in here so she can hear it. And Christopher Holt as how does the current academic structure diminish the value of African American language can bring to the learning environment?
Hmm.
So if I heard the question, it says, how does the current structure of the academic environment diminish what African American people bring to the learning environment? Is that accurate?
Yeah, African American language can bring to the learning
Okay.
environment. Yep.
So if you have ever read any of the work of anybody from the Harlem Renaissance, you will know that those people used standardized American English and they used African American English. Zora Neale Hurston is a prime example of that. But we don't tend to teach that. And in the current environment that we're in, who knows if those books will ever be brought back into the educational system. So the idea that African American language is a lesser than is simply not true. This educational system is set up so that standardized English is the only English that's accepted there. In some places, that's changing slightly, but what it does to the child is to say what you bring to the classroom isn't valued. You need to change in order to fit in here. And I hope that answers the question, but that's how it's devalued. But we have a long history of using African American language ourselves. I mean, in song, you were talking about in the entertainment industry. I think I just and I'm not sure if I was frozen or not.
Yeah,
No,
you said
we
in the
heard you.
entertainment industry.
Okay, great. In the
Yep.
entertainment industry, and even there's some of the regional differences. You're talking about we know in the Lou and in Memphis, it's Maine. So
Yeah,
those are some
man.
of
Mhm.
the
Yep.
variations that we have: East Coast, West Coast, North and South. There's even another variation of English that's happening in Miami. It's a mix of Spanish, Cuban Spanish, and English that's being used by kind of everybody in this the younger generation. And so this language that's changing is the way we sound is different than we would have sounded in 1940. And so we want to think about that not just for African American language, but for all language. And African American is seeping, as we see, into the mainstream in a much broader way. And we want to embrace that because TikTok speech is not TikTok speech, baby. That's African American language.
right.
Baby,
There you go.
baby.
Thanks for that
Yeah.
Hey,
clarification.
baby. Hey, baby.
And
So,
I think I think there is, there is value to having a standardized way of communicating. However,
Right.
it's how do you also treat all the other variations of it? Do you treat them as, like you said, lesser than? So, for example, in South Africa, there are 11 official languages. I often say if that was in the United States, people's head would, explode. But it's so standard in the rest of the world to be able to, talk uh, and, honor other people's language and learn and communicate in other people's language and treat it as equal. For some reason, we have yet to master that here.
Yeah. So we have a question coming out of Los Angeles. Marquise Harris asks, are there any community resources or support systems that you recommend to parents and educators?
So there is a new book that's coming out. It's the Oxford Dictionary of African American Language that I would refer. You can just Google it. Oxford Dictionary of African American Language. It's under construction. Dr. Skip Gates is the lead editor on that. And that's one place that people can look to for understanding some of the vocabulary of African American language. The resource that I would send you to, honestly, is to look back at the work that was done literally during the Harlem Renaissance. Life for Me Ain't Been No Crystal Stair, the work of Cole Bambara, the work of Nikki Giovanni, any of those Black authors that celebrated Blackness, those are places where I would send any person to start. Even the book that Spike Lee did a couple of years ago, Baby Oh Baby, any of those pieces of literature are places to start. You can also, if you are so inclined, go to your university library. Any citizen of any state is able to use the university library. You can go chat with the librarian there. They can give you some resources that are not necessarily available to the general public, but they are because they're in those libraries. But if you just want to get a good foundation, you just want to Google it and look it up, look at the Oxford Dictionary of African American Language and look at any of the works from the Harlem Renaissance to just get started there, to read and really, broil yourself in that language. And Spoken Soul is another book that I would recommend for you. So those are some resources that are available to the general public, and that's where I'd send educators in particular to start, because how are you gonna, say James Weldon Johnson is not part of the American canon?
Or Alice Walker, The Color
There
Purple.
you go.
If you ever
In
read
any of
those,
those,
Excellent
right?
example.
if you
Yeah.
ever read The Color Purple, The Letters to God from Seeley, or God from Seeley, were incredible letters and a really incredible work.
We have
Lila,
some very well read co-hosts here. Just saying.
just saying.
I have a question for Dr. Holt. This is more for you personally. How did this become your passion, your area of expertise?
Great
So
question.
I'm gonna
Great
tell you
question.
the real answer. So I am the oldest of 8.
Okay.
Oh, wow.
I have 6 brothers that are younger than I am. And when I was in undergraduate school and graduate school, they kept telling me about Black males not being able to read, and I was like, what are you talking about? The more time I spent learning about education and the problems with being Black and being literate, the more intrigued I became as to why people believed that. And I started actually studying it, and there was all this research that was saying that African American language was the reason that Black people could not acquire literacy. And I came from a household where my grandfather went to school for day, one day, and we had a house full of books.
Wow.
And he could read. Everyone in my family could always read. Literacy was a big thing. My grandfather was actually born in 1896. So that
Wow.
was a Right. So all of that. And that's how I became interested in it. And the research is not consistent with what we see in the Black community in large part, but there are a number of people who lack access to quality education. And I think that's one of the things that we have to talk about when we're talking about African American English and African American language. And people say, I don't speak that. If you have to give the talk to your son, and you know what the talk is, and you have to talk to your daughters about how they're going to have to be better than and what they can and can't wear because of the way they're going to be judged. We're living in a society where you recognize that as a person with brown or Black skin, you're going to be treated differently. And so the pragmatics of African American language are part of your life. So rather than running away from that, let's run towards that, which is what I chose to do. That's how I became interested. That's why I'm a strong advocate for African American language. When you listen to me, you're like, well, you don't sound like, well, you don't know, and it's not really necessary. That's not the point of the conversation. The point of the
Right.
conversation is to give power to all the people,
So,
to all of
so,
them.
so we want to have one last question. It's a lightning round.
Wonderful.
How can the public support efforts to improve speech and language assessments for Black children?
So the number one thing that the Black parent can do is talk to the teacher. Just literally talk to the teacher. Understand what's happening in the school, understand what your child is expected to do. Talk to your child and listen to your child. If they make sense to you, they should be making sense in the classroom. It's when we have a mismatch between what's happening at home and what's happening at school that we have the question of, is this child disabled, disordered? And a lot of times we want to say they need a whooping, but they don't necessarily need a whooping, right? Something's happening in the classroom that's making the child either not perform the way that they can perform at home, or that they're not getting what they need to get. And we want to investigate that. And it comes from having that conversation with the teacher, with the speech pathologist, and being honest about what you know and being willing to listen, but also being willing to talk. We do not know everything. And we need the parents' help and support to support the children and help them be successful.
That's it, Dr. Mill.
All right. Well, that was wonderful. I especially love to hear your reason how you became impassioned about this. So, thank you so much for sharing. And what happens in our schools again has a direct correlation to our literacy, which then translates to our health literacy, our civic literacy, our financial literacy, and it determines the trajectory of our lives. So, thank you so much for sharing this really important information. And of course, thank you to Mr. Wayne Bruce, so well read, and Miss Lila Mays. Can't do it without y'all. And of course, to my Be Health Empowered family, thank you so much for tuning in and for the great questions. We're going to be back very soon with some more incredible topics right here on Excuse Me, Doctor. And remember, until I see you again, be wise, be well, and be health empowered. Thanks for joining.